What makes Premiere Oncology unique is that we have a marriage of private practice and cutting-edge cancer care. In the office, we have a holistic approach to patient care, including a lot of support systems that allow patients to go through treatment and to improve quality of life. In our office, a patient knows that they're a person that's well known to the office and can feel comfort in the office, not overwhelmed by the setting. We are also remarkably efficient in the office as part of a private care setting, whereas a patient may find that they have to wait weeks or months or longer to start a clinical trial at another center. We're often able to identify a new treatment for a patient quite quickly. I feel that lets the patient know that their interests are being well cared for. I think anyone who has been through this or who has a family member who has been through this knows what a toll it can take on a person's sense of themselves. I think that what we learn in this office is that through support such as art therapy classes, such as psychotherapists and other psychology approaches, even massage and acupuncture, that patients understand that they are an individual, that they are still a vibrant person that's going through a difficult time, but that they have a lot of support on their team and behind them. At Premiere Oncology, we have a number of clinical trials available to all types of cancer, and in particular for lung cancer patients. We have about 20 to 30, at times even 40 clinical trials open at any one time. Some of these are new drugs, often targeted drugs, either blocking growth factors that we know to be important in lung cancer growth. Some of them are blocking the support of cancer, most frequently blood vessels. Several research avenues have shown that blocking blood vessel growth to tumors is an important way to keep cancer under control. Some of our trials combine new agents with previously known effective drugs that may make them even more effective. We are often able to identify for each patient which is the best approach. There are times that using a chemotherapy drug with known efficacy allows us to hope to get symptoms under control quickly, for example, while the addition of the new drug may be more effective than the drug by itself. We also have a number of clinical trials that is unparalleled in the region and really makes the office one of the top early phase cancer trial centers of the country. Many of them are phase 1 trials, meaning drugs early in development. Some of these are phase 2 trials identified specifically for lung cancer patients. At each national meeting, we often have a report presented from our patients' experience. This allows patients, in particular, that have found few options elsewhere, to come here and understand that there are new developments, new horizons, and new options.